have a second biggest threat in disease conditions, that is stroke. One of our senior consultant from the Fortis Hospital, senior consultant neurosurgeon from Fortis Hospital, Cunningham Road, Dr. Ganesh Veerbhadria with us to speak about the stroke. Sir, so let us know what is brain stroke or stroke.
Okay. Good afternoon, everybody. Today we'll know about brain attack or brain stroke, like our Jayashree was telling. What is brain stroke or brain attack means? It is any interruption of blood supply to the brain causes the part of the brain to become non-functional. It will not function and it will produce the symptoms based on the part which is affected. This is brain stroke. Stroke means just a hit in a common language. So we will discuss about this.
So when I say stroke, what are the signs and symptoms so that I can grasp that it is a stroke apart from like heart attack?
Yeah, that's a good word you bought, heart attack. In our general population, heart attack is so common. Everybody know what is heart attack because heart attack causes pain in the chest. Here the brain attack or brain stroke will not cause any pain, so it will be completely painless. Symptoms will be depending upon the part of the brain affected. Like just I want to tell about the brain. Our brain has two parts. One is right hemisphere, left hemisphere, or right part, left part, or in the behind we have a brain stem. Right part of the brain always controls the left half of the body, and left hemisphere or left part of the body controls the right side, right leg, and also the speech. So any interruption of the blood supply to the part, whether if it happens on the right side, the left hand and left leg will become paralysis and patient cannot move. But if left hemisphere is affected with a brain attack, the right hand and right leg will be paralyzed, along with the speech also will be affected. Person will be unable to speak, and if the brainstem part or cerebellum part, if it involves, even person can become unconscious, may develop weakness in all the limbs, hands, legs, and person may reach coma, or if it is in the beginning, patient may be having difficulty in walking and difficulty in balancing. These are the common symptoms we will see.
Okay, so when the stroke happens, what happens to the brain?
Yeah, when stroke happens, like I discussed, brain will be continuously getting the blood supply from the heart. When heart pumps, the blood will goes to the brain. Mainly the two channels which connect the brain through the heart are carotids, the right carotid and left carotid. When this blood supply stops, almost 1.9 millions of cells per minute it will die, and if it is not treated, these cells will become permanently die and lose its function.
Okay, so what are the risk factors along with the stroke? Like when a stroke happens, what are the risk factors that gets involved?
Yeah, the risk factors of stroke, like we commonly see in the general population, you may be knowing people who are having hypertension, means high BP, and diabetes mellitus, high sugars, and obesity, ischemic heart disease. Patient may be already having blood thinners, may have already undergone surgery of the heart, and sedentary life, and alcoholic consumption, and most commonly in youngsters, smoking. All these are common risk factors we are seeing. If these risk factors are uncontrolled, then strokes will happen.
Okay. So now when we talk about the stroke, do we have separate unit or separate arrangement for to take care of these kind of strokes, or separate arrangement or setups to take care of the stroke?
Yes, Jayashri. Actually, this is called a comprehensive stroke care unit. We will tell, or specialized stroke unit. We will tell. So, in a Bangalore, not each and every hospitals have this kind of facility. Only few hospitals in Bangalore have these comprehensive stroke care unit centers. So, comprehensive stroke care unit means 24/7, where stroke care is given starting from acute till the patient become stable and discharged. This will be managed by team of people. This starts with neuro emergency care, then neuro imaging by neuroradiologists, and then neurologists, neurosurgeons, intervention neuroradiologist, ICU, rehabilitation. All this will be under one roof. That means if you have any symptom of stroke, that complete care will be taken, especially acute care of stroke will be given by this specialized comprehensive stroke care unit.
Okay. So, as being a normal layman, I would always have a question. Can the stroke be reversed? Can it be cured, or the patient can become normal?
Yes. This reversal of the stroke, yes. In India also, in recent years, probably after 2014, all this reversal of the stroke treatment, like advanced stroke treatment, what we will tell, it has been started. To tell briefly few lines about before the stroke, just when patient comes with the stroke, we used to just treat with blood thinners or blood thinning injections, and we were just monitoring in the ICU, and we were treating. But where advanced stroke treatment, when it came, the treatment of stroke has changed. This is shortly we'll be discussing about stent retrievals. So this this does, there will be clot busting agents and stent retrieval agents. So with this we can recanalize the vessel which has been blocked in the brain, and this will lead to re-establish the circulation, and number of cells dying in the brain will be drastically reduced, and person will have a good outcome.
Okay.
Yes, of course, like you wrote, stroke reversal is possible.
Possible. Do we have any instruments for it? Like, is it a specialized instrument so that you have to treat with only that so that the patient can be reversed?
Yes, actually we have stent retrievers, we will tell. This is a basket-like device which I want to show you, which I have done myself. Like a cardiac, we have stents. A stent retriever is a basket-like device. This we will insert through small wires and micro catheters through the groin puncture. That femoral artery will tell in the groin, and will go through inside the vessel. Usually we will do in a cath lab under fluoroscopic guidance, and model we have made. So basket-like device, exactly it looks like this. Okay, and this is a basket, and it can hold the clot, and just I will show you. It is just a water bottle I have made. Please consider this as a vessel. The blood will be flowing through vessel like this, and if there is any blood clot, consider if this is a blood clot which is sitting here and passing of blood or water, it is getting interrupted because of the clot. What we will do, we will take the stent retriever, we will pass through this stent retriever, slowly we will go and we will catch hold of the clot, slowly we will remove like this, and blood circulation will be established, and part of the brain which is affected, which get the blood supply which previously it was not getting, and circulation will be established. And to understand one more thing I want to bring it is like all of us in our country, we have so many agricultural lands and fields, and whenever you crop, the fields will be there and continuously it will be supplied through the water channels. So because of that water, all the greens will be alive. Suppose the channel is blocked and the crop will not get the water. What happens? After 1 day, after 2 days, the whole crop will die. The same thing here also, if brain won't get the blood supply, so brain cells also will die and it will become permanent.
Okay.
So this is stented driver, and through this we will remove the blood clot.
That's beautifully explained, doctor. So now when you speak about the villages, there are lots of facility issues. They have to bring the patients to the city. So the thing is, like, do we have any time limit so that I bring the patient to the hospital? So or it can be taken any time.
Yes, actually we will call this time limit like it's a golden hour. Okay, and we have clot busting agents and thrombectomy stent retrievers. So if any patient, if bring in this period, of course the possibility of outcome, good outcome, recovery will be there. Usually as soon as patient develops symptoms, if they come in 3.5 hours within this window, we can give the clot busting agents and we can bust the clot and we can re-establish the circulation when I just now I showed. And if they come in beyond 3.5 hours up to 7.2 hours, 7.2 hours if they come, we can use the thrombectomy or mechanical thrombectomy and we can remove the clot and we re-establish the circulation. So if any patient comes within this window period, most of the time stroke reversal really helps, and person can, we have seen the patients, people living normal life, otherwise they should have become hemiplegics and died in no time. So it is very necessary to bring them in a golden period, so they'll get benefit more.
So you say that 3.5 hours is very, very important.
Very, very important.
Okay.
And one more thing, lot of trials are happening throughout the world. So now gradually this number of hours golden window, it is expanding slowly, and in some of the cases where brainstem is involved, cerebellum is involved, like posteriorly, even this window can be expanded up to 12 hours also, 12 hours to 48 hours we have seen.
Okay. So is it like it's common to know that it's all kinds of stroke are same, or there are any different or types of stroke?
Yeah, there are strokes, there are different kinds of stroke. Example, simplest thing is mini stroke and major stroke I would like to tell. Then another thing is hemorrhagic stroke. That is not today's topic. So what is mini stroke? Mini stroke means any stroke which we discuss now, the symptoms and signs which happens, and this, if it resolves within 24 hours, it may be at home, or you may have brought to hospital emergency, or they may be doing the scan, or in the ICU. If this stroke is reversed, means hand weakness has developed completely and has become normal now within 24 hours, and leg weakness has developed, or speech function is developed, it has become completely normal. If it happens within 24 hours, it becomes completely normal, then we will consider this as a TIA, transient ischemic attack, or mini stroke. And major stroke means that whatever the symptoms which has happened, whether maybe hand weakness, leg weakness, which has not recovered beyond 24 hours or already established stroke, if it is seen, this is called major stroke.
Okay, that's more informative about it. So when I say about all this stroke care units and comprehensive care unit you said, mini stroke you said, so what are the treatments based on it? Like how do we go about it? Like from the beginning till the end, what are the treatments involved in it?
Yeah, what I will do in our hospital, we have a team of emergency physicians. Initially, as soon as patient comes, they will evaluate, they will see the Glasgow coma scale. It's a coma scale. We will assess eye opening, motor response and verbal response, and we'll check the pupils, we'll see the BP, we'll analyze the history, what you have, everything, and we'll take the reports of previous this thing. After assessing, we will do neuroimaging as early as possible, and we'll see the vessel, whether it can be, initially we'll do the CT scan, whether it is normal, abnormal, it will be assessed by us and neuroradiologists, and we'll see the CT angiogram. If there is any occlusion or interruption of the blood supply to the brain, then we will, after detailed counseling with the patient, we will take the patient to the for the treatment of either clot busting agents or mechanical thrombectomy in the cath lab, and then we will keep in the ICU. We will monitor 24/7 each and everything. Then once it is done, it will be taken care. Suppose sometimes few cases what happens, brain swelling will increase. At that time, what we will do to save the life, decompressive craniotomy also we will do to save the life and also to save the cells of the brain.
Okay, so it's very informative, doctor. So like we have understood what is stroke, what are the types of stroke, and what is a comprehensive care unit, and as well as we have really learnt a very important time as 3.5 of golden hours. It's really important to bring a patient on time. So we have learnt about that golden hour. So sir, at the last, now we are we wanted, what could you say, take home message to the viewers?
Yeah, take home message to the viewers, like what I feel is the stroke, what we are seeing, we are not getting adequate stroke treatment everywhere. We are the awareness in the public is very important. Almost we have so many cases of stroke around the world, to say 17 millions of stroke and 6.5 millions of deaths and 26 million survivors we have quoted by WHO. And also WHO says specialized stroke unit, like we discussed comprehensive stroke care unit. If it is there, the chances of good outcome will be definitely enhanced by 14%. And clot busting, what we spoke, which bust the clot and re-establish the circulation, it enhances the good, it increases the good outcome by 30%. And if mechanical thrombectomy through stent retriever, what we showed this, with this facility wherever it is there in these centers, if clot is removed by mechanical thrombectomy in the golden hour, the chance of outcome will be enhanced by more than 50%. So we have to identify the warning signs of stroke. This is very important, and we will call this as a FAST, like facial weakness, hand weakness, leg weakness, and difficulty in speaking.
Okay, so that's really good to know about all this data, which is very minute, but we could save a lots of lives. And I think each one of the viewers who are watching it, they would have understood what is FAST, what is 3.5 golden hours, and what is stroke apart from heart attack. So thank you so much. Thank you, Dr. Manish. So we have understood a lot. Thank you all.
Thank you, Jayashree.
Thank you, sir.
Namaste.
Namaste.